911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases, it is your social, economic, physical, spiritual, and mental well being. Just imagine if you're on 88.5 Sufra FM talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Of course, folks, we are 15 minutes after the hour of 10 o'clock. This is what we say good morning inside this beautiful Monday morning. Between the hours of 10 and, of course, 11 o'clock in the morning, we have Casualty 911. But this morning, we have some technical issues, right? I want to apologize. I want to apologize to you in radio and, of course, general public as well for the late airing of the show, all right? But Miss Wilson is here with me along with her guests. Well, I think we have two of them. Okay, one virtual and the other one is live. It's a pleasure he's here with us. Okay. So while our technicians are working tirelessly to actually restore Facebook and of course the guests via virtual, let me say good morning to you ladies in here. Good morning. Welcome inside another edition of Casual Tonight.
Morning, Erlan.
Good morning.
Good
Good morning.
morning.
How are you this morning?
Great.
I take it that you guys had the best of the weekend.
Very much so. What about you, Nadej?
It was quite good.
Oh, wonderful.
Restful.
Oh, you had a good rest? Wonderful.
Rest,
Let me
right?
just
Now there's
say,
one other party.
Not at all, not this weekend.
let me just say good morning to all our listeners. Those persons normally listening to us on Facebook, let us just apologize for,
Mhm.
not having you on with us. I would like to say a special good morning to my colleague Fawn. I know she's always locked on listening to us. Also, the market vendors. I know today is not a good day for you, but rest assured that you will be okay
Isn't traumatized? Well,
with everything that is going on. I would like to say good morning to our listeners from countries, our parents at home, M&C staff. Let me say good morning. I know you'll have not been seeing me, and you, everybody said you're not seeing me these days, but yes, I'll come by soon. Also, all our listeners in the Soufre Basin as well as Choiseul, let me say a good morning to Glenda over at Debrel Post Office. I'm so happy that she mentioned that she has been listening to me every Monday. Also, Miss Sandra, good morning. Um, Again, it's a good Monday, a happy Monday. Just a gentle reminder, we still have COVID cases rising, and we want persons to take the necessary precautions. continue washing your hands, maintaining social distancing, as well as wearing your mask properly. We want to advocate that persons continue doing these things. Don't forget, the vaccines are available at the various wellness centers within our region. Feel free to call the wellness centers and find out when they are offering the vaccine. All in all, if you have any medical issues, we want you to feel free to come and get the services that are rendered at the wellness centers. Most of them are free of charge, so take advantage of that situation. Prevention is key, as you well know, and we want persons to continue maintaining a healthy lifestyle. Today, I have a very special guest with me. She's my colleague. We've worked together for the past 3 years now. Um, so I will let her introduce herself to you, and then after she has introduced herself to you, then she will try to, if we can actually get our guests online, introduce our guests, and so on. So Nadesh, go right ahead.
Hi, good morning, everyone. Special good morning to you, Saint Lucia. I am very happy to be here with my colleague this morning, Louisa. I know that she keeps you informed every Monday, and today we're joining her for a special show. My name is Nadesh Smith Lammert. I work with the Ministry of Health, Wellness, and Elderly Affairs. I am a health educator attached to the Bureau of Health Education.
So Nadesh, what region do you work in?
Okay, so I am attached to Region One, which is the Grosley from Shock area by Mega
Mm-hmm.
J all the way up to Cap Estate.
Not limiting to other regions. There will
Yes,
need
always
be
giving support to
to
any
other.
officer, any other region. We try our best.
Wonderful. So let us see if we actually have our guest, who's our main speaker for today. If we can actually get her online. Erlan,
Good
are
We're still
morning.
trying. We're still trying to get her.
we still trying?
Yeah, we're still trying.
Okay, so Nadesh, just ask her to hold on a bit. Or if she's hearing us or something.
No, I
I'm
don't think
hearing.
she can hear us.
Okay. So our main speaker today, she's joining us virtually, but since we're having some technical difficulties, hopefully our technical person, who is quite competent, will really see us through this morning.
Facebook, if all the local accounts and things.
Um, so hopefully we can get her through, and then we can see how best we can continue our program, which would be quite helpful to us. We know let me just say, our main speaker today, Miss Louis, Miss or Mrs. Louis,
Miss
Yes.
Karen Louie.
Miss Karen Louis. I think the last 2 years, I
Great.
did listen to one of her opening speech for World Blood Donor Day, and it was quite inspiring. It really moved me. I must admit, um, even Fawn, my colleague Fawn, shared the same sentiments, speaking about how important it is because, having a family member close to you that needs blood at that time, and you have to ask family and friends for assistance. It was, it was it was quite an experience. So I hope our listeners will listen and um, take interest, and the information that is given out today, they can actually pass it on to family and friends, because that is a very important thing, and that is very important in our everyday life. So Nadesh, without further ado, I would let you introduce Karen.
Okay. Hi Karen, can you hear us?
I can. Can you hear me?
Yes, excellent.
Great. Awesome.
So today we have Karen Louie with us. I will let her introduce herself. So you can go ahead, Karen.
Good morning, St. Lucia. Good morning to the wider world. I hope we get our Facebook streaming going on. My name is Karen Louis. I am a senior medical technologist. I'm also the supervisor for the blood bank department of the Ezra Long Laboratory, OKEU, and I have been in this position for the past 5 years. And I think, in addition, I have worked together for the past 4 years actually. And I'm excited to be here, excited to inform solutions, either to inform, to encourage, and to let them rethink the whole donation process. And World Blood Donor Day, June 14th, a day that should be marked in everyone's brain. It should be part of the culture of St. Lucia to donate blood. And let's get this conversation started.
Yes, so today we're going to discuss Blood Donor Day, which is observed, as Karen said, on Tuesday, June 14th, which is tomorrow. Guys, I want you to please give us your undivided attention. I know sometimes we hear stuff like persons asking for blood, and we sometimes think that we would never need blood or we would never have a need to donate blood. But this morning, I want to give you a little more information to that. Karen, can you please tell us the tagline for St. Lucia this year?
The international tagline for this year is to join the fight, join the effort and save lives, donating blood as an act of solidarity. In St. Lucia, we have adopted the tagline, "The time to give is now," highlighting the need for year-round blood donations as a means of sustaining an adequate blood supply. Because we all know the need for blood does not discriminate against time. It could either be at 2 a.m. or at 2 p.m. And the focus for this year's campaign, not only to highlight the need for year-round donations, but to encourage the youth for that humanitarian call to donate blood. We also have to motivate persons who are in good health, who have never donated blood before, to start donating blood. Also, to raise awareness for the need for investments from government and the private sector to build a sustainable and resilient national blood program to increase voluntary blood donations. So key things I'll be saying: voluntary, replacement, and autologous donors. These words will come in and we'll get to know the meaning of that as we go along. And of course, as the carnival season approaches, we need to make sure before we go and have our fit, before we go and bacchanal, to make sure our blood bank is well stocked. Because we know during that time we have increased alcohol being drinking, people are in a festive season. We want to make sure that we are stocked for whatever that might happen.
Very good, Karen. You touched on a lot of important key themes for this discussion. Something I would like us to start off with. Can you just guide us as to the importance of donating blood? Why should I wake up this morning, want to go donate blood? Why?
That's always that's always the number one question, and that's also the number one reason why persons do not donate blood. Why should they donate blood? Persons have never thought about donating blood, and of course, unfortunately, they're afraid of needles, but we'll get to that. Persons should donate blood because, again, we do not know when the need might arise. We know that blood and blood products, because when we're talking about blood, we're talking about everything that's in the system. But when we extract a unit of blood, we can actually separate that unit of blood into three main components, and we'll get into that. So we know blood is needed for persons during childbirth, especially surgeries such as postpartum hemorrhage, which is excessive bleeding after childbirth, your sickle cell patients, your dialysis patients, your cancer patients, your patients with anemia, your patients going in for amputation. All these persons need blood, and there is no substitute for blood at this time. So we need to make sure that we have an adequate blood supply because you just never know. And that's the main, if anything comes out from this interaction today, is that you just never know when you or someone you know might need blood.
Karen, this is what you just spoke about there is so important. And actually, you just touched me personally. Because just recently, last year, around this time, or simply, I think it was around May 28th last year, I remember having to go into, I was pregnant and I was going to have my son. And I remember the doctor saying to me that you are a sickler, and because you're a sickler, we need to get blood for you. So I have worked with you so many years. I'm always hearing you asking persons to come to give blood, the importance of giving blood and the need. And I mean, it's one thing when you say it sometimes, but when you're out of the situation, sometimes you really don't understand the gravity, the extent of the need. And I remember the doctor saying that I needed to get two family members urgently to come to donate blood. And at the time I made the call, I did get two family members to come, but I'm thinking, like, they're just giving the blood. I will not need that blood. Because I'm not going to have an emergency surgery. I'm going to have a normal delivery and everything will be just almost like perfect, right? In that mind of mine. Until when I was actually ready to deliver, and I'm being told that the baby is in distress and I need to have emergency cesarean. One of the very first questions I heard the doctor ask the intern to do is call a lab and find out if she got the two people to donate the blood. And they had to give my name, and I'm hearing, yes, the blood was donated. I'm hearing, okay, prep it because she's going into surgery and we might have that need to use that blood. And I'm like, wow. Karen, this was like exactly what you just said there. Based on your condition, you mentioned sickle cells, you mentioned going to do surgery, you mentioned sometimes when persons go to give birth. And I actually had that very same experience. And I think this is more so why it is important for us having that discussion today, that we need to let persons know that it might not pertain to you now in your mind. Up to this morning, I'm coming down to Supre, and my colleague, she's like, Nadesh, don't meet me here where we were supposed to meet. Go wherever to park. And I'm asking her, why? What's wrong? She's like, don't worry, when you get there, we will talk. And by the time I drove down to Supre, I saw so many people in a specific area, people screaming, people running. I'm wondering what is going on. And it just shows you that we just never know what could happen on what day and when there is the need for blood. So thank you so very much for sharing that. But how do we become a potential donor, Karen? What do we need to do?
My sound, sorry, is a little bit distorted. So can you repeat the question, please?
How do we become a potential donor? What are the requirements? What do we need to do? What our physical, mental, what's up with that?
Okay, so becoming a donor, as we say, our superheroes, you enter in the blood bank family, it's a three-step process. There are certain things indeed that will automatically disqualify you from becoming a blood donor. One, of course, if you've had any cancer. Two, of course, if you've had an STD that is not syphilis, because syphilis can be corrected. And three, if you have certain autoimmune diseases that will disqualify you from being a blood donor. Because persons wonder what I have. Again, we have a lot of persons, unfortunately, in St. Lucia that are hypertensive and are diabetic. That does not disqualify you from becoming a blood donor. Once these conditions are under control with diet and exercise, then that is not a problem. So we're going into our donation process. So we're registering your name, where you live, age, date of birth. Age especially from 17 to age 70, someone can become a blood donor. Of course, at age 17, you would need parental consent. So we go into our interview part, and that is the most important part of the donation process, because we do need in about 5 minutes to get an overall picture of who this person is. So we do have to ask you some personal questions, but our trained and professional staff, who, when you see them, who would not want to give blood. Then we get into the actual fact of donating blood, which takes only about 5 minutes. And again, stressing on our trained professional staff, which keeps that standard in which MHMC has sought to abide by. You should not feel afraid in any way. So we go through that process. But as I said, these are the main reasons why someone might not become a donor. We do have to ask you some questions, and based on these answers, unfortunately, that might permanently disqualify you or disqualify you for a minimum of either 3 to 6 months. Again, persons that have tattoos, we do have persons that have that body art. They are not disqualified, but they can only wait a year after having that tattoo that they can become a potential donor. For our women who are menstruating, is that time of the month. My cousin, unfortunately, is not here with us today, Miss Andrea Charles. I hope you're listening. She is not only my cousin, but definitely a blood bank advocate. And unfortunately, it always seems around that cycle that she is still able to donate. That's the only time she seems to get, and she can donate. So we
That's
said about the
interesting.
tattoos. We said about the menstruation. COVID too as well, we still experiencing some increasing numbers. Sometimes we're in a double digit solutions. We need to take care of ourselves. We need to practice that social distancing, wear our masks, sanitize. But you can donate blood 28 days after having COVID, again, providing that you are symptom free, no fever, no headache, no sore throat, no dizziness of the sort. As as well, you can donate blood 2 weeks after each vaccination shot. So we've covered it. We've covered the COVID, we've covered the tattoos, we've covered the menstruation, we've covered your diabetics, your hypertensive patients, and these are all reasons why people think that they cannot donate blood, in which you can. But again, we're stressing on that interview process to making sure you answer these questions honestly, because it is not only to protect you, but whoever you are donating blood to.
I want to ask a question in regards to donating blood. Is it the freshly donated blood that's going to be used, or blood that has been stored already? Because most times you go on your blood type if it's A, B, or whatever. So again, most person would want to ask the question: Is it my blood? Because you asked me to come and donate. So is it the freshly donated blood that's going to be used on the patient, or blood that was being stored already?
Stored in that blood bank? That is indeed a good question. The testing time to test that unit of blood takes at least 24 to 48 hours. So, yes, indeed, the unit of blood that will be given to Nadesh if she had to have a cesarean will not be from her husband or from her brother. It will be in our blood bank. And that is why it is important to answer these questions honestly. So once a unit of blood gets into our fridge and it only lasts for 35 days, then that blood will be used. There are certain instances in which we have definitely tried to make that happen where we did not have blood. And as soon as we got the blood, we were able to test it one time and to give. Also, as well, for information purposes, when we're doing our testing, remember any unit of blood that is not from you might be incompatible. And when we say incompatible, it is not a match. So even though Nadej and I are O positive, Nadej, I think you are O, you'll correct me. So even though Nadej and I are O positive, when we do our preliminary tests, unfortunately, it is not a match. So even though we are of the same blood type, we have preliminary tests that needs to be done in the blood bank to make sure that it is a match. So that is why we need to have that continuous supply of blood in our fridge. So I can just pull another unit and say, okay, she's O positive, her pressure is dropping, she needs to get a unit of blood before she goes to have her surgery. We can take another unit. And that is why we need to make sure that we have that supply. But that's always a question that persons ask. But anything that does not come from you directly, there is always a possibility that it will not be compatible with John Doe or Jane Doe, even though it is the right blood type, because it's not from you. Hope that answers.
Yeah, yeah, yeah.
Karen, just to reiterate something that you said, I know that a lot of persons normally ask that question as it pertains to, can somebody who had COVID-19 was diagnosed, confirmed, can they give blood? And you said yes, 28 days after.
28 days after, and that's from the World Health Organization, WHO.
Very good. And what about just to confirm again, even after being vaccinated, a lot of persons think that vaccinated persons can't give blood. And then you're saying, yes, they can 2 weeks after they've given the first or second dose.
That is correct.
Okay. And another question I find that is very important. Persons ask that question all the time, and they actually think, I think it's a myth, a misconception. Persons believe that persons who have tattoos cannot give blood. But you're saying yes, once it's a year after they
A
can.
year after having that tattoo. And again, we will ask Where did you get that tattoo done? How was that tattoo done? Making sure that the needle was sterilized. You saw the tattoo artist remove it from the packet. You saw them sanitize, making sure that they have their gloves on as well, because hepatitis is one of the most common STDs a few years ago that you were getting via transmission of STDs. So that is why we make sure that we have it after a year. But we do not have that problem. In St. Lucia, all of our tattoo artists are registered. All of them use the products sanitized, one needle per patient, etc. or client.
Tell us a little more about the need for voluntary donation because it's not mandatory. You cannot force anyone. It's really on a voluntary basis that you would decide to give blood.
Right. So you have three types of donors. Something that we hardly mention is you have autologous donors. So in Adesh's case, she could not donate because she's pregnant. Also, too, you can donate 6 weeks after pregnancy, and you can donate 6 weeks after pregnancy with breastfeeding as well. So you can donate soon after giving birth once everything is okay and you get that okay from your doctor. So we have autologous donations, which accounts for less than 1% of our donors fall into this group. When we say autologous, that means self. So if Nadesh, for example, is going in for fibroid surgery or for a total hysterectomy, she's taking out her womb, etc., she can go to her doctor, Dr. Charles, Dr. Samuel, one of my two favorite gynecologists, and say, Doc, can I donate blood on behalf of myself? You must get consent from a physician to become an autologous donor because the
Wow.
guidelines will be different for you. You do not have to go through that interview process because we just extract the unit of blood, we place it in our fridge, we do test it for our sexually transmitted diseases, and then when it is needed, the entire unit of blood is given back to you. So we want to encourage again with working with the Bureau of Health Education, living that healthy lifestyle. Your iron-rich foods, your spinach, your lentils, your kale, your beets, to your fruits and vegetables. Because becoming a blood donor, you are a responsible person. You eat healthy, you drink responsibly, and you live a responsible life. So we're stressing on that, but unfortunately, that accounts for less than 1%. Voluntary donations, and from an international standpoint, that is where globally we would like to see St. Lucia, along with other countries such as Suriname, Guyana, and also Southeast Asia. These groups have more than 80% of their blood donations coming from voluntary blood donors. These are donors that know every 3 months for men and every 4 months for women, they know that they need to deposit their unit of blood in the blood bank. And these are known as your safest set of donors because their only motivation is giving the gift of life, giving someone else the chance to smile again, the chance to see their loved ones again. And we have our replacement donors. And that is where St. Lucia falls into that category, along with countries such as St. Vincent, Dominica, and St. Kitts, whereby the majority of their donations are for friends and family. Meaning that there's again, I'm using her as a key prime example, is going in for surgery. She calls her brother, she calls her husband, she calls her close friends. Hey, I need to make sure that I have blood in the blood bank before going into surgery. Now, these persons sometimes tend to think that I need to give blood and it is not voluntary. And then they get afraid. And we do not want that. We want to make sure that giving blood becomes part of the social norm of solutions. It becomes our culture to make sure that we go so that we can increase our numbers for voluntary donations because less than 50% of our donors are replacement donors. So we need solutions to come and donate. Make it aligned. You know what? It's about that time before the carnival season because that's what's coming up. Our main things are carnival, that's our lumens. During the summertime, that's our lumens. And before the festive season of Christmas and New Year's, that's our lumens. So before we get into those festive seasons, we need to make sure that we can come and donate our unit of blood. for 30 to 45 minutes, that 1 unit of blood can save as many as 3 lives.
Wow. Wow. People out there, let's listen. 30 to 45 minutes can of donating blood can actually afford 2 to 3 persons to save the life of 2 to 3 persons. Isn't that just amazing? And as we said before, sometimes we really think far-fetched that this does not cater to us. However, you just never know when you might be in a car accident, when you might something might happen, or you might actually need to go and do surgery. You might have the information in advance. However, you don't know if there will be a need for you needing the blood. So let's not just wait for an emergency or wait for the time to arise. But if we can, if we don't have a medical background that is preventing us from donating blood, can we please make a special effort? Let us try to think of it. Maybe if we start now as doing it every three, as Karen said, 3 or 4 months, it will become something that we get used to. I think after you donate blood, Karen, you give a little token, right? You give a little vitamin, I think, to help persons regain the energy that would be needed, right?
Yes, with special thanks again to Heineken St. Lucia for they have partnered with the blood bank for over 15 years, supplying beverages to our donors after donating, which is important to as well after donating what we need to do. Unfortunately, for our gym persons, they will not be able to exercise just for that day. They need to make sure that they drink lots of water, lots of fluid, because 90% of your blood is made up of water. So we're taking out a pint of blood. And the fun fact, the average person has about 8 to 12 pints of blood. So we're just taking one. And that unit of blood that we take out will be replaced by your bone marrow, reproducing new and fresh blood cells in about 6 to 8 weeks. So that is why we have that 3 months for men and 4 months for women time frame. And of course, women have a lower hemoglobin count because of their cycle. So we give you your beverage to make sure that you start increasing your fluids. No exercise for that day, no alcohol for the next 6 to 8 hours, no heavy lifting on the arm in which we use for the blood withdrawal process for the next 6 to 8 hours as well. And that's it.
Karen, what about consuming alcohol even before you come to donate blood? What is the time frame like?
We would prefer that we need our persons to be coherent, because again, when we ask our interview questions, again, most important part, we need to make sure that you answer these questions honestly and you're coherent of the questions that you're asking. So we would advise persons not to smoke any form of marijuana or tobacco or to have alcohol before they come and donate. Also, to make sure that they have a good solid meal at least an hour before coming to donate, drinking lots of water, making sure that you have a good night's rest, because you know you're coming to save a life. So you're prepping yourself to be that superhero that you are.
I have a question. Do y'all do a follow up after the person have donated blood, like the following day follow up with the persons if they're okay and how they spend their night and so on? Like a how you call it?
Yeah,
And
fine.
after the fact they have donated blood to follow up with the patient that actually donated the blood to find out if everything is okay with them.
I'm actually going to write that down, because unfortunately, we do not call every donor that has donated the next day to make sure they're okay. So that is something that we can definitely do in the future. We can do that. However, if something we do post for now, we do use the post office to send your letters. We test for your HIV, hepatitis B, hepatitis C, syphilis, HTLV1, and your blood type. We're looking to enter the 21st century, putting something online, but that's personal information. So we need to try to develop either a password or code or something so that you can access your information via email. So if there is something that is wrong with the blood, and when we say it is positive for particular STI, unfortunately, we do discard that unit of blood because it does not get into our fridge at all. And we will have to contact the patient, let the patient come in for a second test. If the second test comes out positive again, we do advise them to either go to their own doctor if they wish, or they will visit the Castries Health Center if they're in the north of the island, or the St. Jude's Hospital, which is our second collection site, if there is a positive for counseling and for treatment one time.
I don't know if I missed it while I was multitasking, but I want to ask this question: is it a difficult process in actually having persons who come donate blood?
I didn't hear, is it a difficult?
Process, like in terms of having persons to come in to deliver blood or donate blood, that is it a tedious thing? If it's something difficult, persons hardly
Mm,
come? No, because
It
I
is.
know the reason why I'm asking, and I know some parts of the world, persons are being paid to come and donate blood. Now we in St. Lucia, but malt they give me a little malt, and I mean, kind of thing. That person are looking for more than that. You understand? So hence the reason I just ask.
No, 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 that's okay. There, in the Caribbean, we do not have paid donations. But internationally, for example, in Canada, England, and the US, there are persons that get paid for donating blood. Why we do not do that in the Caribbean is because persons are going to lie on my interview because they know that they are going to get either $20 or $50 for donating their pints. And we want to make sure the main reason for persons coming to donate is to save a life, not for the added benefit of getting monetary donation for that. So that is why, from a Caribbean standpoint, we do not pay our donors. So it
Nice.
is challenging for persons to come and donate. Again, because the number one reason they never thought about donating blood and becoming part of the blood bank family. And two, unfortunately, they're afraid of needles. And for now, there is no way, maybe in the next 20, 30, 40 years, but for now, there's absolutely no way that you cannot get a unit of blood from having a needle. You don't have to look at the needle and you don't even feel it, to be quite honest. Again, I'm saying the trained and professional staff, they make you feel comfortable. They let you know that we are going to insert the needle to stay still. And then in 5 minutes, you're saving up to three lives.
Nice.
Karen, just for clarification, you said I know that you screen the blood, so you do test on the blood, right? So,
Correct.
for instance, if you test somebody's blood and you realize that they're positive for HIV, apart from sending them the printout of their results via the post office, you contact them, you actually
Yes.
make a call to that individual so they would know over the telephone that they need to come in, but they would know something is up, right?
Yes, we call them to come in. We do not state it over the phone because
Oh,
you could imagine that shock
yes.
value happening instantly. But we call them to come in and we schedule an appointment with them so that we can test again to make sure that bag number 456 belongs to Karen Louis, belongs to Nadejex, belongs to John Doe, etc. To make sure that unit comes from that person. So we test again. If it comes out positive again, we do call them back in. We do the initial counseling, and I'm happy to say that we have two trained persons that are able to test in pre and post test counseling for our positive patients. Then we refer them to either the doctor, because that's their option, or to Castries Health Center or St. Jude's if they're in St. Jude's to test and treat for further testing if necessary and for treatment.
Okay, great. So, so far we have covered the donation process. Would you agree, Karen, or is there anything that you would like to touch on as it pertains to the donation process?
We have covered the donation process of registration, interview, and blood withdrawal. What to do before donating blood, making sure you have your lots of water, you're drinking your fluids, making sure you have your good night's rest, refrain from your alcohol and your cigarettes, marijuana consumption. Again, marijuana consumption is not a deterrent. We just need you to be coherent at the time for you to make sure you answer our questions. We've said for after donating as well, again, you're limiting your alcohol intake, you're limiting your tobacco intake and marijuana intake as well afterwards. You're making sure you drink lots of water, you're not taking anything heavy, lifting anything heavy on the arm that you donated, and you go through your regular life, because donating blood does not change any aspect of you. It actually gives you that sense of accomplishment, person solutions, and the wider world who's listening right now, that you have that accomplishment, that you donated. As I said before, your 1 pint of blood can save up to 3 lives. Because persons will think, but wait, am I donating 3 pints of blood? No. That one Sprite bottle that you have, and as I said, the body has about 8 to 12 of that, can save 3 lives. Your red blood cells, which is what you actually see coming out, then actually spin it down and you get your yellow portion, which is known as your plasma. So these are your gunshot victims. They lose in blood, they lose in plasma. We actually can give these components separately. Your platelets, which is something that you don't see, we give that to persons to control their bleeding. So your gunshot victim comes in. We need to make sure that we have your packed red blood cells, we have your plasma, we have your platelets coming in. We have persons that have specific conditions that they need only platelets or only plasma, and they don't need the red cells. So that is why when you come in, you will see that that bag has two other bags attached, and that's just for the other two products that we can actually separate and we give to the patient based on the actual condition. So that's to show you that your 1 pint of blood again can save up to 3 lives.
Yes.
Hold on,
Yes.
Karen. Um, I know we've talked about the process, but if, for example, I want to donate blood, do I make a call to set an appointment or do I walk in? What is the procedure? And
You
then when
can
somebody listening to the radio program wants to come and donate blood, what is the procedure for them to do such?
You can come in. Unfortunately, now in the north of the island, we only have our mobile blood bank, which is located at the William Peter Boulevard, Monday, Wednesday, and Friday. But today we're starting off Blood Week. So we're starting off with one of our main contributors, Sanders Latok. They're back on board with us. So our mobile blood bank is at Sanders Latok now from 9 a.m. until 3 p.m. But normally, Monday, Wednesday, and Friday, we at the William Peter Boulevard, and every Tuesday and Thursday, we at the OKEU. We try to go out now. We since COVID is not going to win us. So we have to live with COVID now. So we try to go to our various companies. Last week, Thursday, we went to J Gas. Last week, Sunday, we went to one of our churches, which has been a very big contributor during the COVID pandemic. Our churches has really helped us to sustain our blood supply. But you can come in, you can call the blood bank at 458 456, sorry, 456 8230. That's 456 8230. And our mobile blood bank is 285 9642. 285, let me just double check, right? 285 9642. These are our two numbers. You can set an appointment with us. I will let one of our team members know that you're coming in to, and will tell you which location that the mobile is going to be. We look forward in the near future to have a donation site at OKEU where persons can come in. Unfortunately, we do not work on a weekend or holidays, so we look forward to that. So we have big things that we want to do for the blood bank, and as blood month is here, the month of June, we also want to take this campaign from June to December. So we want persons to know that there's a need. Everybody knows something about diabetes. Everybody knows something about hypertension. And now everybody knows something about COVID. We want to make sure that persons know something about donating blood. So from June to December, look out for our solutions. We'll be trying to come onto different radio stations. We'll be trying to go out to different companies, establishments, churches to get persons involved. Again, to be making sure that the blood donation process, donating blood is part of the culture of St. Lucia.
Um,
Karen, I think right now everyone is gearing up. Well, not everyone, but most of us, because as you know, St. Lucia have not enjoyed Carnival for the last 2 years. So this year, quite a few people are heading on the road, going to be going to all the parties, all the activities. I think most of the activities or parties have already started. And as the days goes by before Carnival, we're going to see that increase. Also, we're going into summertime, and you know, summertime is party time.
Right.
So persons are going to go out. Persons are going to engage in consuming alcohol and stuff. What do you say from the mobile blood bank or from the blood bank unit? What is it like for you during this time? What would you like to tell our persons, our listeners, our St. Lucians out there, what to do, how we can do it during our carnival season?
That is challenging for us. Carnival time, summertime, October, and November, December into February. That's our low seasons because persons have other things going on. Again, Carnival is coming in, family reunion, people coming down that they don't see the need. So the only advice that we can give from the blood bank department is to before you get into your festivities, come and drop a pint of blood for us. That 30 to 45 minutes can help us if everybody brings at least two persons. Again, fun fact, the average person needs at least 2 to 3 units of blood. When I a short story to illustrate how much the need for blood does not discriminate again in terms of amount. When I first came, that is 19 years I've been working in the blood bank back and forth with university. We had a patient again after delivering a child, she just could not stop bleeding. So that one person got 10 units of blood in a matter of 2 days. We also have one of our blood bank advocates, Miss Vanita Bruce. A simple procedure that she came in was to remove her fibroids, and she was admitted to ICU. She too had to get 11 units of blood in a matter of weeks because not every day she was getting. So we had to monitor. Sometimes the hemoglobin or your iron level was dropping. So we had to make sure that we had blood there. And again, that was actually during the summertime. So it was a challenge for us. We do not want these things to continue to happen, solutions. We want to make sure that we can meet the demand for blood at any time. So before we go into our festivities, before we go into our normal life, we need to make donating blood part of our normal life. So
And
that's the best advice I can give.
also, for the carnival season and for summer, the demand to me is even twice as high as persons are engaging in the fast driving and reckless driving and persons the accidents and injuries that require the need for blood. So I'm hoping that persons are listening out there, are actually using their phones right now, messaging their family members, their loved ones. The same way we go out and we do cooler fits together, we do grocery shopping together, we do beach activities together. We need to come as a group and as a team and as a family to do our blood donation because especially with the days and the months coming up, with the activities that are being hosted, we are expecting, I mean, it's not something that we want, but we need to at least put measures in place. So in the event we have any serious activities, accidents, sorry, any persons getting shots and stuff, we want to know that we have our blood, a sufficient blood to give to our fellow persons.
Exactly.
I
We
have
need
a question.
yes.
Karen, you made mention of you're at the William Peter Boulevard on Mondays, Wednesdays, and Thursdays, and now you
Fridays.
Always Wednesday and Friday.
Friday, sorry. And also you will be out there at the various business places. I didn't hear you mention anything as it relates to the north and the south, sorry. If anybody's interested, where do they go to in the south?
In the south, they go to. That's a good question indeed, because we are on casualty 911 in
You heard
Sufre.
me?
Pardon?
You heard the question?
Yes, I said that's a good question because we are on casualty 911 in Sufre. So our persons for that southern section of the island, they can go to the St. Jude's Hospital to
Mhm.
donate. They do not need to make an appointment. They can just walk in. The mobile blood bank was not functional for some time now, but it should be up and running. If it is not, the hospital, St. Jude's Hospital, is the main donation site for the south of the island. That being said, too, if there is a patient that is doing surgery at St. Jude's, persons in the north can actually donate blood for that person, and we have a courier system, and we can transport that unit of blood to St. Jude's. So the location does not matter where you donate, because once we can meet that demand for that patient who needs it, we do what we need to do. We have our courier system in place. So St. Jude
Wonderful.
Hospital for persons in the south. If there is someone that is in St. Jude's and there is a patient at OKEU, they can donate in the south, and we actually have that courier system to transport that unit of blood from St. Jude's to OKEU.
Thank you so very much.
Yes, definitely.
Karen, it was such an amazing time this morning. The hour passed by very quickly, I think, because we had a
Indeed.
little late start. But as usual, it is really a pleasure to have you on any program or at any activity that we're hosting. The information you shared this morning was so valuable. This is really something that we need to take time to think of and at least make it part of our usual plan. Also, listeners, St. Lucia, we would like to use this opportunity to thank all our donors out there for the life-saving gift of blood. It is not something that is easy, especially I think people think twice because that they know the blood is being tested for STDs. This is always something that persons get a little nervous about when they have to go in to get their blood tested for different sexual transmitted infections. However, you donors out there are doing a great job. Please continue doing it. If you can, once it's possible, please, I am pleading to you that you continue to donate blood. We really do appreciate it. And of course, Karen, we are so grateful and appreciative of you being here with us this morning, and by extension, the blood bank unit. Thank you so very much. I will hand over back to Louisa.
Karen, I must say thank you. It's always a pleasure because that's not a topic we normally have on our radio program, and it is such an integral part of our lives. And some of us don't see the need for it until it actually reaches our doorstep, where we have our family member that actually needs the blood. Then we really understand how important it is to donate blood. Um, we look forward we look forward in having persons from the south, based on the information that you have given here today. I mean, come out and donate blood, and that would be something that we're hoping that people kind of change their behavior towards, and make it as part of their family routine, as long as they are able to. Family and friends, like Nadesh said, the same way you can organize an event within family and friends. I mean, you can also organize that event where you can go and donate blood as family and friends also. And that is a positive step rather than the alcohol drinking or the fetting with family and friends. Also, I would like to thank you so very much. I really, really appreciate you coming here and making that time to come to the radio program in such a short time. I remember when Nadesh called and say, "Well, let us do that," and then you were so eager. I am grateful. The other thing, we're looking forward to having you on the radio program. If not later on this year, maybe that's something we need to do again to create more awareness in our community. Also, I'm hoping that when they have many activities within our communities in the south, we can really utilize the blood bank coming to our various communities. If St. Jude's is not up as yet, I mean, this is something, the community awareness, and to be there in the community and asking persons to donate the blood would be something that community members should look forward to. And again, thank you so very much. I must admit, like I said, I think it was 2 years back or last year, where you did the address for this very same World Blood Bank Day. And I was really, really impressed. And I'm looking forward, if you are the one doing the address this year again, to listen to you via YouTube. And I hope continue the good work. I mean, it is you and your team, in fact, continue doing the good work. And I hope St. Lucians really appreciate the effort and the time that you'll have put into that, to the work that you do.
Thank you
Erlan?
so very much. We do this because this is not only our job. We do it because we do love it as well. It is stressful at times. So I just want to say on behalf of the Blood Bank Department and by extension OKEU, thank you so much for having me on this program. This will definitely not be the last. I also want to thank my team members of the Blood Bank as well as the testing team of the serology department. We've had some long nights to make sure that we maintain that quality standard of healthcare for all persons and solutions. The time to give is now. Thank you.
Thank
Thank
you.
All
you.
right. Now that there concludes the show, guys. Till next time, God willing, take good care of yourself. Have a wonderful day. Okay.
Thank you,
Bye.
Erlan.
You're welcome.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM, talking, questioning, sharing your experience, information, education,